I'm Dr. Tendai Chouare, a reproductive endocrinologist, OBGYN, and a minimally invasive GYN surgeon. And today I'm going to be talking to you about saline sonograms. So saline sonograms are sometimes called SHGs for short, or SIS, saline infusion sonograms. And these are office procedures that are usually done by an OBGYN. A radiologist can do them in a radiology department. And as a reproductive endocrinologist, I do them quite often in my office. The main people who need to have this procedure done are going to be people who are going through an IVF procedure. So we're actually planning exactly where we're going to place the embryo before we actually have the embryo and we're putting it into the uterus. The other people who may need to have it done are people who have had an ultrasound, and we suspect that they may have an anatomical issue inside the uterus, or they may have fibroids that may be pushing into the cavity of the uterus, or they may have polyps as well, which are also inside the uterine cavity. And these may be affecting them getting pregnant or actually causing abnormal bleeding as well. The other group of people who often have saline sonograms are women who've had, unfortunately, a miscarriage, and we just want to make sure that all the pregnancy tissue has come out of the uterus before trying again for another pregnancy. I like to do the saline sonogram cycle day 5 through 12 because that's when the lining is actually the thinnest, and so you're going to be able to see any abnormalities that may be inside the lining. So I usually like to do it, have my patients call first day of their period, and we get it scheduled day 5 through 12 of your cycle. Usually I also recommend that my patients take pain medication about 1 to 2 hours before they come in for the procedure, just to make it a little bit more comfortable. If you think about it, the uterus is actually a muscle, and when it gets cold fluid into it with the saline sonogram, it can sometimes contract, just like any muscles you have. If you go out into the cold and you're not appropriately dressed, your muscles contract up. So the uterus is exactly the same thing. So we want you to feel more comfortable while you're doing the procedure. So I always recommend taking some pain medications about 1 to 2 hours before you come in for the procedure. I also check for any allergies, like an iodine allergy or a latex allergy as well. Once you're comfortable in the stirrups, we then will place a speculum similar to when you're having a pap smear done. And the speculum is basically looking for the cervix. And once we're able to see the cervix nice and clearly, we'll then sterilize the cervix with the iodine. Sometimes it feels a little cold, sometimes it stings a little bit as the cervix is being sterilized with the iodine. After that, we'll place the catheter through the cervix. It goes into the outside neck of the cervix, into the internal part of the cervix, just into the cavity. So then we're then able to be able to infuse the fluid directly into the cavity of the uterus. We then take out the speculum, and then we do the ultrasound. With the ultrasound, we're doing the ultrasound at the same time that we're infusing the saline through. So it may feel a little crampy. You may feel a little bit of cold jolt from the fluid. Some people feel it from the catheter as well. And as we're doing the infusion of the saline, what it's doing is it's blowing up the uterus, kind of like a balloon, so we're able to see anything that's inside the uterus, like polyps or fibroids or scarring or leftover pregnancy tissue if you've had a miscarriage. And then sometimes we can actually see if fibroids are pushing into the uterus and causing distortion of the cavity of the uterus as well. After we've done that, I usually will take images in 2-dimension and also 3-dimension as well. So we do a 2D and a 3D ultrasound. Once we finish the ultrasound, we'll take the catheter out. You may notice that you have some fluid leaking afterwards, or there's a gush of fluid as we take out the catheter. That's completely normal. That fluid may be stained a little bit brown from the iodine, or sometimes it is a little bit blood stained. Again, can be normal as well. That fluid will be leaking out for about 2 or 3 days, sometimes a little bit longer, and that's basically all the fluid that was inside the uterus to blow the uterus up like a balloon. That fluid will then leak out over the next couple of days. After the procedure, you may still notice a little bit of cramping, but a lot of times, most of the cramping resolves after most of that fluid has flushed out of the uterus. So this is the catheter that we use, and you can see this is where the saline will get infused through, and this portion of the catheter is inside, and this portion of the catheter, the tip of the catheter, that's what's in the cervix, okay? And this portion of the catheter actually is quite bendable, so if your cervix bends upwards, that portion can sort of travel through and go up into the cervix, and we just place the catheter through the cervix. So that's where the fluid then comes out of the cervix into the uterus through this portion. So now I'm just going to show how the catheter comes through. So the catheter goes through into the cervix, and then what we do is we actually infuse the fluid through, and you can see the fluid coming and blowing up the uterus. And then we're able to see if there's like a polyp or anything in there, or if a fibroid is pushing inside the uterus, or if there's any scarring inside the uterus that might cause any issues. And then after we've infused all the fluid through and the fluid comes through, we then take out the catheter. And then you might notice some of the fluid leaks out. And that's what the saline sonogram is. So this is an example of a saline sonogram with this being the uterus. There's the cervix, and that's where the catheter comes through. So you can actually see the catheter there. And then this is the actual muscle of the uterus. And then you can see the faint outline of the actual endometrium on the outside here. And then this is the inside of the endometrium, which is blown up, kind of like a balloon. You can see that the fluid, the saline, is inside there, and it's blowing it up to make us see if there's any polyps or fibroids that may be pushing, or any polyps or anything on the inside of the uterus. This saline sonogram actually looks very normal. There's no polyps or fibroids or any anatomical issues that may be of concern in this particular patient. And this image actually shows the 3D image of the uterus. There's the catheter just there. There's the inside cavity of the uterus, and it looks completely normal. And then this outside portion is the outside muscle of the uterus there. And that looks completely normal. So you can see it's blown up with the fluid, and it looks nice and normal right in there. And then these images again, you can see the cervix right here. This is the muscle of the uterus, and the fluid is looking through, and we've cut through that portion. And then here you can see where the catheter is coming through. This is the inside of the uterus blown up like a balloon, and this is the 3D image or three-dimensional image, and we're looking down on it through the actual uterus and the muscle of the uterus. This is the muscle of the uterus, and the inside cavity looks completely normal. And then this final picture just shows cuts through the uterus. So the uterus has been cut through like this, and you can actually see as it's getting through the different images of the uterus with the slices that are going through the uterus, cutting through it. So this is a double, triple check to make sure the inside of the uterus looks completely normal on each of the sections. So the saline sonogram is quite a simple office procedure that you can have, and it takes around about 5 to 10 minutes to complete. So you'll expect to be in the office for that long. Comment below and let me know what your experience of the saline sonogram has been, and if you have any questions or any ideas for other videos that you might like to see.